Hello, my name is India Peace, and today we are going to briefly discuss how Black mothers matter. Don't get me wrong, all mothers matter, but we are going to just briefly talk about how Black mothers' life matters as well during pregnancy. At least 700 mothers die yearly from childbirth related. On average, Black women die 3 to 4 times more than white women during childbirth. Crazy how the USA is one of the most dangerous places to give birth in the developed countries. The reasons of this and the factors include racism is one factor for the maternal death. Health and equity gaps plays another part in this problem as well. Black mothers are seen over-exaggerating their symptoms to their providers when complaining to them about the pains they are experiencing during their pregnancy. Funding is also another issue. Most hospitals are understaffed and don't have the latest technology when dealing with patients. Those who are seen as medical acceptable hospitals experience this problem the most. I'm now going to play a video for you guys. How the mother explains how daughter have difficulty breathing after birth and later died from the complications several hours later.
Jessica Lemessurier has this report from New York.
2 months ago, Shawnee Benton's daughter Shamani died suddenly. Just 30 years old, she died of a pulmonary embolism a fortnight after giving birth to a baby boy.
This is the only picture of them, the entire family together. So a few days before she transitioned, there was a concern about her breathing, and she felt okay the next 2 days. And then she had the emergency situation at the house where they live, and she ended up going into cardiac arrest at the house. And then we know how it ended. Within 12 hours, she was gone.
Shamani was taken by first responders to the local hospital.
The hospital she was in is one of those hospitals that does not get the resources and the funding put into it like other hospitals do. They did a great job with her, but it's in my mind that they didn't have what they needed. It doesn't make sense. She should be here. Whoever has been taken like this, should be here. Or whoever's been in the hospital and struggled for life. They should be able to walk free and do what they need to do to care for their babies.
If Shamani had been white, would she have survived? That's the question that haunts her family. Because in the US, the rate of maternal mortality is 3 times higher for Black women than it is for white. That's according to the Centers for Disease Control and Prevention. And in New York, the situation is even worse. The risk is 8 times higher. Black women of all backgrounds are affected, even those like Shamani, who are well educated and have good healthcare coverage. Medical researchers say the root of the problem is racism.
Racism was baked into the DNA of this country. And since then, every policy has reflected that history, including the myth that Black people don't experience pain like white people, which affects people who are going to give birth and are complaining of pain or may have a complication that is not taken as seriously because simply of the color of their skin.
Last year, New York City launched an initiative to reduce maternal deaths among Black women. Amongst the measures, more funding for certain hospitals and more training for medical staff to make sure they don't have racial prejudices. The city is also working with doulas like Chanel Portia, who is based in Brooklyn. A mother of 6, Chanel trains doulas to provide childbirth support to pregnant women at affordable rates.
We have to start to trust ourselves, to trust our bodies, to trust our autonomy and our agency and our own power, and understand that you have rights and no one can take those rights away from you. It's your body.
The issue of maternal mortality among Black women has been raised in the 2020 presidential campaign, with Democratic candidates Bernie Sanders, Elizabeth Warren and Joe Biden saying it's time to address the epidemic.
Transformation is needed in a country built on racism to be able to tackle the need of the people that you refuse to protect. You need Black women to take charge and help pave the way for what is needed for safer deliveries. Staff need to be educated on respecting the concerns of every person that walks through their doors, regardless of the race and the wealth background. More funding needs to be accessible to medical staff. More training may be needed for health professionals from the receptionists to the EMT who may have to rush patients to hospital, etc. More doulas should be present in the communities that serve Black women to help guide them through a healthy pregnancy and delivery. What can we do now to help? Help find organizations such as Black Mamas Matter Alliance and others like it whose objective is to help Black mothers have a safe delivery. Black Mamas Matter Alliance help to push policies to better Black women, implement Black Mental Health Week, which is April 11th through 17th, to help educate people about the risks of pregnancies and complications, as well as give out suggestions. They organize help push for racial equity where Black mothers are not affording good health care. They also hold the government responsible and is pushing policies and laws into effect that can help Black moms receive better care. The most disrespectful person in America is the Black woman. The most unprotected person in America is the Black woman. The most neglected person in America is the Black woman. This is a Malcolm X quote. The message still holds true over 60 years later that the Black woman is the most disrespected, neglected, and unprotected person in America. We are at a point in our lives where that has got to change. And that would be it. Thank you so much. Bye.